My name is Stephen Jivraj, so I'm the admissions tutor for this degree programme in population health. And essentially what that means is I, along with other academics and our admissions officers here at UCL, I look through the applications for the course and make assessments on those kind of things, and also teach on this course in population health. And what I'm going to do for about the next 15-20 minutes is just give you a little bit of a flavour about what the course is all about, and also tell you a little bit why I think studying population health is important and useful for doing an undergraduate degree. So one of the reasons why population health is becoming increasingly important is because as a population, as a global population, we're becoming older. What we see from this graphic is the percentage of the population aged 65 or over, forecasted for the year 2050. What we see is that for all of Europe, large parts of North America, large parts of South America, Asia and Australasia, that by 2050 it's forecast that more than a fifth of the population will be aged 65 or over. Can anyone give me a reason why they think an ageing population is important in terms of population health? What do we know about the relationship between age and health? At the back? Generally, that's the case. Certainly in terms of our physical health and to some extent in terms of our mental health. As people get older, they're more likely to have health issues. So, if there are more older people in society, whether it be in the UK or almost any other country in the world, it means we need more people to work in this area in population health. And that doesn't mean we just need more doctors or more nurses. We also need people who can analyse health data and support the doctors and nurses in terms of prioritising the services and using data to make recommendations on what we should be prioritising in terms of our health. Now, partly a consequence of the ageing population, but also because we tend to spend more money on healthcare in relation to the healthcare products that we use today, particularly in terms of pharmaceutical medicines. What's happened in the last 30 or 40 years is that there's been a considerable increase in the relative amount that we spend on healthcare as a proportion of our GDP. So what we see from this slide is that this selection here of developed countries, there's been this marked increase in the percentage of GDP that's spent on healthcare. So that's what we see there on the vertical axis, the percentage of GDP that's spent on healthcare. Interestingly, there's one country that deviates from the rest, and that's the United States. And since 1970, the United States has seen a considerable increase in the proportion of GDP that it spends on healthcare. Now, the United States is interesting because although it spends more on healthcare as a proportion of its GDP compared with these other countries, amongst this group of countries, at a population level, it actually has some of the poorest health outcomes. So it's not a direct transfer in terms of spending more on your healthcare necessarily means you have, as a wider society, better population health outcomes. And what's interesting about the United States is that it also has large levels of what we call healthcare inequalities. So the difference in the health of people in, say, rich and poor groups is much more varied in the United States than most of these other developed countries. So that's interesting. Spending money on healthcare doesn't necessarily mean you have general average outcomes that are better, and also in the case of the United States, we also see big healthcare inequalities. Now, healthcare inequalities is not something that's just restricted to the US. In fact, here in the UK, in fact, here in central London, we can see quite big differences in people's health dependent upon where they live. Now, I'm sure all of you are familiar with the tube. How many of you took the tube this morning? Vast majority of you. Some of you may have even taken the Jubilee line, and interestingly, what this infographic shows is produced by the London Health Observatory. It shows the average life expectancy at birth of people that live in neighbourhoods that surround tube stops along the Jubilee line. And if you look at the difference of people that live around Westminster in central London, if you look at male life expectancy on average reduces by about 1 year for every tube stop that you pass towards Canning Town in East London. In fact, the male life expectancy at birth in Westminster is about 78 years, whereas in Canning Town it's about 72 years. Now, what explains that could partly be something about the areas. Perhaps maybe there's something about Westminster, maybe the built environment, that's better in terms of people's health. Maybe there's something about healthcare services, that even in a small geographical area, people have better access to healthcare services in Westminster than they do in Canning Town. What's more likely is there's something about the individual characteristics of the people who live in Westminster compared with the people that live in Canning Town. Now, if we were to look at a data set like the census, we'd quickly be able to see that people who live in Westminster tend on average to be more affluent than people that live in Canning Town. And we know that people's affluence is related to their health and how they can protect themselves against any adverse health consequences. And the degree here in population health, and in fact a lot of our research here in the Faculty of Population Health here at UCL, is looking at what causes the differences in people's health. So is it where we live, or is it our individual characteristics? Or do those things interact together to mean we have good and bad health? And that's a really important area of our research, and an important area of what will be taught on the degree here in population health. Now, the degree here in population health is part of something called QSTEP. Has anyone heard of QSTEP? No? Not too surprising. It's quite a new a teaching programme which has been set up or is funded by an organisation called the Nuffield Foundation, along with a few government bodies as well. And what QSTEP's all about is about improving the quantitative methods training that is given to undergraduates. Because for quite a long time now, particularly in the social sciences, in sociology, political science, much lesser extent economics, but many of the social sciences, graduates have come out of doing a 3-year degree without doing almost any quantitative methods training. So by quantitative methods training, I mean be able to analyse big data sets, big quantitative data sets. And why that's a problem is because graduate employers are increasingly telling universities what we need are people with quantitative data analysis skills. And so this QSTEP programme has been brought about to really solve that issue. And we're fortunate here at UCL that our degree programme in population health is part of this QSTEP programme, as well as a collaboration with a number of other departments here at UCL. So our social science department, epidemiology, which is us, geography, and the political science department. And those departments have come together to improve the quantitative methods training that's given to the students on our degree programmes. And what the great thing is about that collaboration is that the teaching that we give in quantitative methods comes across in terms of a multidisciplinary perspective. So we don't just teach quantitative methods in terms of how we use quantitative methods in population health. We look at quantitative methods from this much broader perspective. And why I think that's important for our students is that when they go out into the wider world, they're probably going to use, when they use their data analysis skills, they're going to want to know things that are part of this broader perspective and not just sit in academic silos, which don't really mean a great deal in wider society, or when you go on to work in the graduate labour market. You don't see many people who are epidemiologists or geographers or political scientists. You generally see people who are just data analysts or maybe policy analysts. Okay, so what's in the degree in population health? Well, it's a typical 3-year undergraduate degree programme in the social sciences. In the first year, we have a set of compulsory modules. So all of our students do the same courses. So these include the epidemiological transition, measuring population health, social determinants of health, and research methods in population health. And all of these modules really kind of give a perspective in terms of the history of our health, in terms of the practice of our health, and in terms of what causes the differences in the theoretical underpinnings in terms of what determines people's health. But as well as those 4 courses, there are these 2 QSTEP courses, these quantitative methods courses, which are shared with the political scientists, the geographers, and the social scientists. In the 2nd and 3rd year, our degree in population health becomes progressively more optional, and you can start to specialise in that element of population health that interests you most. So we have a rate with some of the units in the 2nd year are compulsory, but we do have optional units too. And in the 3rd year, the degree becomes even more optional. I think the only compulsory modules are the QSTEP modules, which are always compulsory in every single year, and a dissertation. But a dissertation is a large project that you'll do, and that will be something that you'll be able to determine and really take ownership of and do something that particularly interests you. Okay, I'm going to skip that slide. I'm just going to tell you a little bit about optional units. So here at UCL, for most of the degree programmes, people are strongly encouraged to take units in other parts of the university. And that's good because you might come here to study population health, you might come here to study geography, you might come here to study human sciences. But as you kind of progress through your degree programme, there may be other things that interest you. And so doing our degree programme, you can take these other modules in other parts of the university. So you can do units in global environmental change, geocomputation and computational social science. Both of those are programmes in the geography department, or sorry, are modules in the geography department. Data science and big data analytics, that's a unit within our political science department, and you can see for yourself a range of different courses there. These are not the only courses, there are many courses you can do. And we have agreements, particularly with the geography department, the political science department, for people to do units in those departments. But almost any department at UCL, you can theoretically take a unit in those different departments. Okay, but what else can you expect in addition to the teaching? Well, a unique feature of our course is that we have paid internships. So for a number of students that do our degree programme, and our students that are currently on the degree programme, they'll be doing this next year, will be going to work in industry, might be going to work in a public sector organisation like the NHS, maybe working in a university, or it could be working in a private organisation. And what our hope is that the students on our course who are learning particularly about the quantitative methods will be able to apply their learning to a kind of real world environment. And that's a fairly unique feature about our course, and I think something that will be really good for those students that are able to take advantage of it. We also have induction events as part of our course, so induction events for our course specifically and the wider Q-Step teaching programme. Every student at UCL is assigned what's called a personal tutor, and that person is on hand for the entire time you're here. So for most students, they're for 3 years of their undergraduate degree programme. And that person is available particularly for academic matters, but also for any personal issues that you're having. That person becomes, for our students, becomes particularly important in the preparation for the second and third year when they're starting to think about the optional units that they might take. This person can help you think about that kind of broad perspective and potentially help you think through what it is you want to do in the future and think about the units that will be most appropriate for you. We also have dissertation prizes for our course, so the students in the third year, when they take their dissertation, the best dissertations are awarded cash prizes. And there is also a clear pathway to postgraduate study. So this year there is starting a Masters in Population Health in our department, and the students that do the undergraduate degree in Population Health will be very well prepared for that course. But there are lots of other Masters programmes here at UCL and in other UK institutions that our students will be very, very prepared for. I think almost any postgraduate degree in the social sciences, students that are doing our degree programme will be well prepared for. And I think potentially maybe you come to study population health, but maybe something else interests you, maybe it's economics or whatever it may be. I think our degree programme will really prepare students who want to go on to study for a postgraduate degree. One thing I'm often asked about in relation to our course is what can I do when I graduate? What types of careers will this lead to? Now, I can't say that we have graduates that are doing these things because, as Graham said earlier, it's the first year that our course is running this year. But what I can tell you is the types of organisations that are coming to us and asking to take the students that we're going to send out on internships, and tell you about the types of organisations that have presented themselves to government and the organisation that's funding the Q-Step programme and is saying we need more graduates with quantitative method skills. And they include government departments, particularly in the healthcare setting. So the Department of Health, Public Health England, Health and Social Information Centre. These types of organisations have many roles for data analysts, for health economists, which our degree will really prepare people for. There are also many important health functions at a local level now. So local authorities have important health functions. NHS obviously also operates on a local level. And there are also things called clinical commissioning groups, which are groups of GPs that come together to prioritise services in their area. Now, there are many support roles that are required in those types of organisations, again, to enable these organisations to make decisions about where they prioritise things. And people who can analyse big data sets are very important to them. But as well as the public sector, there's also lots of third sector organisations, charities like Cancer Research UK, British Heart Foundation. These organisations conduct a lot of research internally, and so the students that come to do our degree programme, I think, will be well prepared to go and work on in terms of those organisations. Those organisations also commission a lot of research as well. So there's a lot of research manager roles which those types of organisations have, which again I think our students will be very appropriate for. But not just the public sector or the third sector. There are many private organisations, commercial healthcare providers like Bupa, but also private consultancy firms and think tanks that do a lot of research and a lot of health policy research, which again I think students that do our degree programme will be very well prepared for. Now, in terms of what we're looking for in terms of our applicants, as you can expect, it's a UCL degree programme, so the entry requirements are quite high. So for our current intake, how many of you guys are year 12? So vast majority of year 12. So for people coming in what will be 2017-18, the entry requirements for our course are a range between ABB and AAB at A level. But we don't ask for any specific A level. So any A level that you do will be appropriate, providing it's accepted by UCL, which I think covers most A levels. Maybe general studies is maybe excluded, but the vast majority of A levels that you'll be doing will be included in terms of the A levels that UCL accepts. And we do that because we know that some of the students coming to our course may have a more physical science background, so may have just done physics, maths, and maybe chemistry, whereas we may have other students that come from a more social science perspective, or maybe even a humanities perspective. And so we're not specifying any particular A levels that you must do. But we do ask, because there is this large quantitative methods training as part of the course, we ask that you have an A in GCSE maths or statistics. Now, if you don't have an A in GCSE maths or statistics and you are interested in doing the course, then it doesn't completely preclude you from applying, especially if you're already doing A-level maths, and if you were to get a B in A-level maths, that would certainly trump the requirement for the GCSE maths. But if you have a B in GCSE maths and you're not doing A-level maths, again, it's not a complete red line. If you are interested in the course, feel free to contact me and we can kind of discuss your particular circumstances. But as well as academic performance, we're also interested in students who can make the most of the many opportunities that are available here. And you'll hear in the next presentation from one of our current students in terms of the opportunities that are available here for students. And you also hear from someone from our Access and Widening Participation team later, who will also talk to you about the many opportunities that are available for students. But we're also interested in students who want to be challenged, and students who think critically, and students who want to engage both with other staff and other students. Because there's a real big change in terms of how we're thinking of our teaching here at UCL at the moment. We're trying to move away from a model where students are purely consumers of knowledge. So where you come to a lecture like this and a lecturer stands in front of you and tells you all about the things that they know. What we want our students to do is to engage with the research process. So we want our students from a very early stage in their undergraduate career to actually be contributing to the research that we're doing as academics and contributing to academic knowledge. So that will be helping to write research papers, doing data analysis. And so that's a real kind of change in how UCL is seeing its teaching and seeing students contributing to the research process. Okay, that's all I had to say about the degree. We have time now for questions. If anyone wants to ask something about the degree specifically or maybe about today. Does anyone have any questions that they would like to ask?